atrial fibrillation ablation is our way to get to the triggers that initiate atrial fibrillation. If medications have failed, this is a good way for us to get to the source of the atrial fibrillation, and many times by isolating it from the rest of the heart with this ablation procedure, we can get better outcomes in terms of prevention of recurrence of symptoms and better quality of life going forward in comparison to medications. An atrial fibrillation ablation is very specific for atrial fibrillation. Ablation is a procedure whereby you go after the triggers that initiate the tachycardia. So there are different fast heart rhythms in the top chamber of the heart. This ablation is focused on isolating areas in the heart that we know atrial fibrillation initiates. And if we can prevent those initiating factors from affecting the rest of the upper chamber, we can hopefully prevent the atrial fibrillation from occurring. It's done under general anesthesia, and it's done a lot like a heart catheterization. It's done with catheters that go up from the groin up into the heart, and then we go to the source of the ablation, and we can either freeze it and prevent that area from affecting the heart, or we can use heat energy to prevent it from getting the rest of the heart. It takes about 2 hours to accomplish. Afterwards, you recover overnight, and then the next day you go home. It's been proven to keep you out of the hospital. It's been proven to give you a better quality of life because the recurrence of this atrial fibrillation is significantly decreased. And life is short, and the fact that if you're having to suffer with it day after day, month after month, we can give you back that by having a procedure like this and alleviating you of those symptoms. You get your freedom back with an effective ablation for your atrial fibrillation, but the key is you got to do it early. Don't wait until you've suffered with it for a long time, because the longer you suffer with the atrial fibrillation, the harder it is to get rid of.